Sandra, thank you for that wonderful reporting. That was so beautiful to be able to see that. Thank you for bringing us that. We never see it like that. We always just see them kind of near the water being released into the ocean. So it was nice to see it from the start there. Sandra, thank you so much. Staying here, I guess, with the weather theme, right? We're talking about preparing for a hurricane. And it goes beyond putting up shutters and stocking up on food and water. It's important to prioritize your health as well. I'm here with Dr. Lori Rothman, a primary care physician with Tampa General Hospital Concierge Health. Thank you so much for being here with us.
Oh, it's my pleasure.
So let's talk a little bit about, we know what to do when it comes to stocking up on water and food, but we should also prioritize our health. Tell us how we do that.
No, absolutely. It's really important. I think sometimes it's easy to forget about that because in the flurry of trying to get all the other supplies ready, but it really is important to have a plan to focus on health so that you can stay healthy before, during, and after the hurricane and prevent certain illnesses and injuries as well.
Yeah, and unfortunately, we see sometimes in hurricane preparedness, sometimes people fall off of a ladder while putting up shutters, or we hear of having heart attacks. What do we need to know before we start preparing?
So before starting preparing, first of all, know your limitations. If I'm going to think about what people need to do is, one, have an emergency plan. So part of your emergency plan is how you're going to plan for your health, knowing your specific health conditions and potential limitations. So you want to make sure you and your family have an evacuation plan if you need to evacuate, who you're going to call, how you're going to manage those things.
And you say there's 3 items that every family should have to be ready for a storm. What are those 3 items?
Absolutely. Well, one is the evacuation plan. Know where you're going to go, what you're going to, because the first thing to do is prevent a problem.
Right.
2 is prescription medications. For people who take prescription medications, it's really important that they have a 7 to 14 day supply on hand and that they store those medications in a dry, cool place, that you have them protected. We can get an emergency refill as soon as you know that there is a hurricane warning or a declaration of emergency in the county. You can go and get a 30-day supply from your pharmacy, even if you're not due for it. So have a list of all your medications, have it, one electronically and one in
writing,
that is protected. Keep it with your medications. Make sure you have everything you need. The next thing would be to have a first aid kit. So what do you need in case of a minor illness or injury? You want to have something to take in case of fever or pain, an antihistamine, antidiarrheal, something to take in case you just don't feel well in general, first aid supplies. You want to have bandages, gauze, saline, gloves, a mask, scissors, just so in case there is a minor illness or injury, you can treat it.
Always definitely need to be prepared. Once a storm does pass, what do you usually tell patients?
So one, safety. Check your environment. Is there floodwater? Floodwater is really dangerous. It can carry a lot of bacteria and viruses. So you never want to go in floodwater with an open wound. If any of your medications have been contaminated with floodwater, you want to discard them. And then you want to check your food supply. If the food in your refrigerator has gotten warm or defrosted, you probably want to discard it and avoid, any downed electrical wires and debris, just to be really careful and cautious about that.
Dr. Rothman, thanks so much for being here and giving us this good information here. If you want to watch this interview or learn more information, head to our website, WPBF.com. Nikki, always good to be prepared ahead of a hurricane. Of course, the